There are more than 121,000 confirmed cases throughout America, and more than 2,000 people have died. The situation in New York is critical. Hospitals there are overwhelmed, and soldiers have been sent in to help. And tonight, 800,000 physicians signed and sent a letter to the American president saying social distancing must continue in order to save lives. Jennifer Johnson has more.
In hard-hit New York City, a grim statistic. On Thursday and Friday, COVID-19 killed New Yorkers at a rate of 1 every 17 minutes. The situation so severe, U.S. President Donald Trump is considering a quarantine on New York, New Jersey, and parts of Connecticut.
Some people would like to see New York quarantined because it's a hot spot. This would be an enforceable quarantine.
The U.S. Navy hospital ship Comfort will dock in New York Harbor Monday with more beds, doctors, and supplies. Still, some New York residents are trying to flee. Police are on alert along the U.S. East Coast.
I feel bad that New York is getting such a bad rap sheet when it's really all over the place.
New Yorkers coming into Rhode Island are being stopped and registered with the National Guard.
It's what I know to be necessary in order to keep Rhode Islanders safe.
New York is still facing a severe shortage of ventilators, masks, and other essential supplies. Healthcare workers fearing for their lives.
We already lost our first nurse in New York City. We're going to lose more.
Under an emergency order, the Pentagon is reactivating former troops and deploying them to hard-hit regions. New Orleans, Detroit, Chicago, and other metropolitan areas are all facing an overwhelming increase in COVID-19 patients.
There is no congregating allowed.
Doctors in hospitals across the country are being forced to make gut-wrenching decisions: who will get a ventilator and who will not. Terrifying for patients.
I felt like my lungs weren't expanding. You feel the sensation of drowning.
COVID-19 tests remain in short supply, but the federal